Okay, so this section is going to cover the visual system. What I want you to do is focus only on the slides I'm going to talk about in terms of review for the final exam. And so the slides I want you to focus on with the visual system is slide number 2, slide number 4, slide number 6, slide number 7, slide number 10, slide number 17, slide number 18, slide number 24, slide number 29, slide number 30, and slide number 38. So let's look at slide number 2. And so here, what I want you to know from slide number 2 is what are the accessory structures associated with the visual system. Those social structures being, for example, the eyebrows, eyelids, eyelashes, tear glands. Also, what are the tracts that are projecting visual information? That would be the optic nerve, optic tracts, and the pathways, which we'll talk about a little bit later. Let's turn to slide number 4. And so here, all I want you to do is to know that the lacrimal gland produces tears to moisten and lubricate the eye. And so this is the thing I want you to know about slide number 4. Slide number 6. I want you to know, are the extraocular muscles innervated by the ocular motor nerve? Okay, and so there's 6 extraocular muscles. The ocular motor nerve innervates 4 of the 6, and the 6 muscles shown here, being the inferior rectus muscle, superior rectus muscle, medial rectus muscle, inferior oblique muscle, and levator palpebrae superioris muscle, which lifts the eyelid. So if one was to have, for example, a stroke involving the ocular motor nerve or damage to the ocular motor nerve, one of the things they will see is that the eyelid would droop. Okay. And slide number 7, I want you to know the innervation of the two other extraocular muscles. First, being innervated by trochlear nerve, cranial nerve number 4. That is it will innervate the superior oblique. And lastly, the abducens, which will innervate the lateral rectus. Okay. Let's turn to slide number 10. So the anatomy of the eye. The part here that I want you to focus on is 2 points. The first is the macula lutea, or fovea centralis. This is the greatest area of greatest visual acuity. Okay, and so that's one thing I want you to know about. The other is about the iris and the pupil. The iris controls light entering the pupil, and that lastly is that the lens is held by a suspensory ligament attached to the ciliary muscles. And so this is going to be involved in terms of accommodation, in terms of near vision. And this is controlled by the autonomic nervous system. Next, I want you to turn to slide number 17. Okay, and so 2 terminologies I want you to be familiar with is myopia, which is nearsightedness, and hyperopia, which is farsightedness. Okay, I could give an example. For example, I could talk about whether or not myopia is nearsightedness, true or false type of question. Next, turn to slide 18. Here, what I want you to know here is that the ganglia cells are the cells that are giving rise to the optic nerve. Let me repeat that. Is that the ganglionic cells in the eye are giving rise to the optic nerve. Okay. The other thing is about the rods and the cones. The rods are for non-color vision, and so they play a role into the light adaptation. The cones are for colored vision. Okay. Now let's turn to slide number 24. And here I want you to be familiar with the path, the visual pathway, coming either from the temporal part of the visual field or the nasal part of the visual field. This would be the nose in this area right here. And so as you look at here, is that the temporal part, into the representation on the retina, is medial. The nasal part is lateral. Okay. Now, coming from the optic nerve, we notice that the nasal part doesn't cross at the optic chiasm. The temporal part does cross at the optic chiasm to the contralateral side. And so where they project to, either ipsi or contra, depending on where we're talking about nasal or we're talking about temporal, they're going to synapse on the superior colliculi, which is part of that midbrain, or they're going to synapse onto a relay nuclei. This relay nuclei is in the thalamus, called the lateral geniculate nuclei of the thalamus. Now, when the optic nerve crosses the optic chiasm, it is now called the optic tract. Okay. Now, after they synapse onto the lateral geniculate nucleus, it becomes the optic radiata, okay, or optic radiations. And there they're going to project to the visual cortex, specifically into the calcarine cortex is one of the areas that they're going to project to. And so as you look at here in terms of the mix now looking at both eyes, is that we see that on the contralateral side, coming from here, is again the temporal is going to cross over. The nasal does not. Okay. And the temporal from the contralateral side crosses over to the other side. Okay, and then it's going to be projected over. So the visual cortex is going to have a mixture of getting contralateral input from the lateral from the temporal part of the left visual field, okay, on this side. And then on this side right here, it's getting input from the temporal part of the right visual field, as to the left cortex, visual cortex. Okay, next, let's turn to slide number 29. Okay, and so here, other visual pathways I want you to be familiar with. So the ganglia cells, this is ganglia cells coming from the retina. They're giving rise to the optic nerve. They also project to the pretectum area, and the pretectum area is near where the midbrain is located. This is between the thalamus and midbrain. And what this is going to do is this is going to coordinate the pupillary reflex. Pupillary reflex to light, and this is going to involve the oculomotor nerve, the preganglionic parasympathetic nerves. The other that we talked about in terms of with the hypothalamus that's involved in terms of your circadian rhythm is your suprachiasmatic nucleus of the hypothalamus, and so this is going to be involved in your day and light cycle, and so you have projections from the visual cortex here too. Last is the superior colliculus in the midbrain. This is going to coordinate your head and eye movement. So these are three additional visual pathways I want you to be familiar with. Let's turn to slide 30. In terms of eye disorders, shown here is that I want you to be familiar with the different terminologies and the clinical deficits associated with these visual dysfunctions. Okay, a good example is astigmatism. The cornea or lens are not uniformly curved, or strabismus, thus lack of parallelism of light pathways through the eyes. glaucoma, that's increase in intraocular pressure by aqueous humor buildup, cataracts, that's clouding of the lens. Macular degeneration, which is common in older people, you're going to see a loss and acute vision. And this is because of the fact that you're affecting the area of the retina, the macula lutea, which is the area of greatest visual acuity. Diabetes also is going to affect peripheral circulation, affecting the eye. Okay, last we're going to turn to slide number 38. Okay, here, now, visual impairment associated with the cortical. So we're seeing damage to the cortical area and to the occipital area. And so these are the different types of cortical damage associated with that. You look carefully with the underneath the slide, you'll see descriptions for each one of these different types of cortical damages that are going to manifest itself into the visual impairment. Okay, and with that, this is the material that I want you to focus on for your final exam.